I'd be like, you go to your room, and then it'd be 5 minutes later, all right. You know, I'd be that sort of mom. Hey, you want something to eat? Oh, gosh. Yeah, that's the type of mom I would be. I don't know who's beeping away. Someone's beeping away. Okay. All right, so exam number 3. It's going to be next Wednesday. Okay, so be prepared, have your laptops. If you need chargers, make sure it's fully charged or whatever you need, but you want to make sure you've got your laptop ready to go, yeah? What else do I want to say? It's 100 minutes, but I don't think it's going to take you 100 minutes. And as I say, we are going to look at some of these pieces for sure for today. So let's look at okay. So it talks about hypertension. So we're looking at the chapters for antihypertensive meds. What I need you to know are things like, what type of drug class, for instance, would somebody who's Afro-American, would you give them lisinopril or would you give them calcium channel? Look at you guys. Yeah.
You said what you give a what now?
A calcium channel blocker. And you may give what's called a thiazide as well, but a calcium channel blocker. Good job. Okay. Angina. I want you to know the process. Remember, there's a process for angina, meaning if you're going to give nitroglycerin tablets, you remember the sublingual tablets that you give? How would you give them? Yeah, so total, you've given a total of 3 tablets, aren't you? So you're going to give the 1. So while that's not working, you're going to give 911 immediately. Mm-hmm. Okay?
After the first one? I thought it was after the second.
No, after the first. If the chest pain isn't relieved, then you are going to call 911. Okay? So you give that 1, if the chest pain isn't relieved after 1 tablet, you're calling 911. Now you can then give the other, and then you can give up to a total dose of 3, but you need to know that you're telling your patient to call 911 after the first tablet, if it doesn't relieve it. Okay. Beta blockers. I don't know if you remember, but I talked about some of the side effects of beta blockers. Anybody remember the effect it can have on the blood sugar? Does it? Hypoglycemia. Yeah. It could cause either. It could cause either. A lot of the time it causes hypo, but it definitely has an effect on the blood sugar. All right. It can do predominantly hypo, but it can cause it to elevate. All right. Remember adenosine. Does anybody remember that drug, adenosine? It's a dysrhythmic drug. Remember I said you can watch the cardiac monitor and something happens when you give it? You'll see asystole. So look that one up. Okay. Warfarin. What we said, what is the antidote for warfarin? All right. You know that. Good job. All right. We talked about things like heparin, and we talked about medications that are anticoagulants. So if somebody's had a heart attack and we give a thrombolytic drug, what does a thrombolytic drug do?
It clots, something about the.
What did you say?
It clots the blood.
I couldn't hear you.
It clots the blood. Like
It busts the clot. Yeah. Yeah. It dissolves the clot. Yeah. It's a clot buster. Thrombolytics. Those are thrombolytics are the ones that bust a clot. All right. Sounds like a rapper, doesn't it? Bust a clot. I mean, we sort of just does. So that might help you remember it. Bust a clot. Anyway. You like that? Especially with a British accent, right?
Yes.
All right. Make sure you know your levels, your labs for heparin. What labs are we monitoring? What lab is it? Yes. Oh, this is a goodie because I just talked about this one with you guys. What did I say that niacin causes that some people like most?
Skin and like
Tingling and flushing, yeah. Some people say they really like that sensation. I'm like, you guys are crazy. Try it. Try it. But it causes like an itchy, your skin will sort of flush. Mine, I used to go into like a bright flushing, but it's normal. It's just, I want you to be aware of that. Okay. All right, know your cholesterol values, please. Know what they are. What is an HDL? Is that the good cholesterol?
Yes.
H for healthy, yeah. H for high.
What was the H what?
H for healthy.
HDL?
No, HDL. HDL. Pardon? For HDL, I want it above 50, 50 to 60. I personally like it higher than that, but the books say 50 to 60. Let's see. Loop diuretics, Lasix, right? Things like Lasix. Why do we like Lasix? What's so good about Lasix? You're trying to get fluid off. Fast, yes. It causes rapid diuresis. Yeah. All right. So talking about diuretics, do you think you would give this in the evening?
No.
Would that be a good idea? When would you give it?
In the morning.
In the morning. Okay. We talked about red blood cells and blood transfusions. Which IV fluids would you give with a blood transfusion? Yeah, it's the only one. Anything else is going to cause the blood to clot. Okay? All right. I want you to look up levothyroxine. Levothyroxine. And know what that is. What is that? Yeah, it's a thyroid medication, okay? But I want you to know about that particular medication. And also, I want you to know if that comes, how the dosing comes. Is it micrograms or milligrams?
Micrograms.
Correct. So be aware of that. All right. Lots of different questions. All right. Remember when we talked to, well, you may or may not remember, but we talked about antibiotics, and I said that some patients are allergic to penicillin, right? Are they just allergic to penicillin, or can there be other types of antibiotics along? So yeah, but what about, remember I talked about, then we went on to ones that have clavulanic acid like augmentin, and then I said, what about cephalosporins? Do you remember I talked about cephalosporins a little bit, like Keflex and things? Anyone remember that? No? Yes? No? So if somebody is allergic to penicillin, could they possibly be allergic to cephalosporins? What do you think? Possibly, right? What about tetracycline? What's the problem with tetracycline? Yeah, so I can't really hear you, I'm sorry. Okay, yes, you're right. You're right. And what about other
Women and children under 8.
Yeah. You're going to go out in the sun in this one?
No. Avoid dairy.
Mm-hmm. I want you to know the order of when you collect blood cultures or urine cultures. Which order does that go in?
You said no both? Blood culture?
Well, I suppose what I'm saying is if somebody has an infection, am I going to give antibiotics first? Okay. All right, men and hypertension. Men and antihypertensive medications don't go well, particularly because of why? Anybody remember?
Erectile dysfunction. Erectile dysfunction.
Yes. Yep. Yep. Erectile dysfunction, impotence, blood pressure medicines, right? Remember I talked about, well, a little bit. I want you to know the difference between disinfectants and antiseptics. And know what C. diff. What is C. diff?
It comes from giving antibiotics.
Yeah, could do. It's an infection, yeah. What type of, what are you going to see when you see C. diff? What would the patient look like? Meaning, what would the signs and symptoms be? You mentioned it, Jessica.
Diarrhea?
Yeah, really bad diarrhea, right?
Watery and mucusy.
Very watery, yeah.
But it smells terrible. Yeah, you don't ever forget it.
Certain antibiotics cause things like tinnitus. Anybody remember which antibiotics those are? Which ones?
What did you say that caused what?
Tinnitus. What's tinnitus? Remember? Not ear infection. Ringing of the ears. Anybody remember what type of antibiotics cause that? Remember, usually it's the ringing in the ears and the what? The might, yeah. What type? Did you say Gentamicin? Yeah, so look up that class of antibiotics, please. Okay. Ringing in the ears tonight. What's this? When I point here. What's back here? Kidneys. Yeah. Nephrotoxicity. Okay. What is MRSA? Does anyone remember what MRSA is? It's an infection, isn't it? Staph infection. So you need to know what antibiotics cover staph infections. And I'd like you to know the vancomycin. What are some of the side effects you can see with vancomycin, and think about that medicine. You're going to give it quickly? Would you give that med quickly? No. No. All right. There is a class of drugs that has what's called a black box warning. Anybody remember what that could be?
A classic.
No, it's called with a black box warning.
Misoprostol?
No, an antibiotic.
Oh, okay, wow.
Anybody remember?
Acne? Oh, no, I'm just kidding.
Nope. It's all right. So what I want you to do is look up quinolones. Quinolones. Okay. If somebody has the flu and they want Tamiflu, can they get it? When can they get it? 2 days. Good job. I just talked about this as well. Isoniazid, what is that? For any of you that were listening.
You said iron.
Isoniazid or INH. What is INH? INH, not MPH. INH. You might want to look that one up. INH. Might want to look it up. Might want to look it up. And the clue is some vitamins are needed with it. Which one?
6.
Peroxidine. All right. Remember I told you about, I call it amphotericol. Remember me talking about a drug called?
Terrible.
It is terrible.
Is that the estrogen?
No. Otherwise, nobody would be on estrogen. Amphotericol, amphotericin. I want you to look up amphotericin.
What you just said, Miss Leslie?
It's a drug called amphotericin, and we talked about it. Amphotericin. Okay. Remember I mentioned to you about a drug called ribavirin? Do you remember ribavirin? Any of you? One of you? No one? Ribavirin? I even talked about it regarding the potential on the HESI. Ribavirin. It's not TB, no. I suggest you look that one up.
Oh, category X, it stays in the blood for 6 months, it's antiviral.
Yes, and what's the problem with it? How do you give it?
I'm gonna write that down.
Look it up. There's a big issue with this drug, with the way it's given.
Used in combination.
Look it up. All right, I just talked about the H. pylori bug, didn't I? What bug is that? H. pylori, what does it cause? What's it cause? Causes ulcers, yeah. So, what are we going to give? What did I say you're going to give for H. pylori? Well, you could, but what's some of the things that you would give? So for H. pylori, remember it's a bug, right? It's a bug. That's your clue. What do we give for H. pylori? Mm-hmm. Good job.
What did you say? Inhibitor and antibiotics. I think she said flagyl.
Metronidazole is one of them, but that's along with others, but yes. All right. If somebody has a vaginal bacterial or vaginal fungal infection, I want you to look up the patient teaching, please. Okay, look up your laxatives.
You gotta know what they are.
One particular one. Yep. And I also told you, I talked about patients with diarrhea, and I talked about basically bismuth subsilicate, Pepto-Bismol. Pepto-Bismol. What's the problem with that, remember?
Yeah, I remember you talking about it.
What can it do to the
Do
tongue?
something to the teeth.
No, tongue.
Oh, it turns your bowel movement black.
It does. All right. Let's see if I'll leave that one for you. See if you can get that. Bear in mind that with children now, we used to give a medication called Ipecac, and it would induce vomiting. We don't really recommend that anymore. We recommend that if somebody has eaten something or ingested something that they shouldn't, meaning like if a child's taken medication they shouldn't, you're calling poison control, okay? And one of the teaching points is to make sure that the mum and dad, the family, have the poison control number readily available. Okay, so bear that in mind. Yeah, IPECAC, Ipecac. We used to say take some Ipecac and it induces vomiting, but motion sickness. What would we give for that? Any idea? Yeah.
Like C,
Scopolamine.
oh, CS.
If you get this one wrong, I don't know what I'll do. I don't know what I'm going to do if you get this one wrong. Trying to think how to. What deficiency? Let's see, I'm trying to not tell you and tell you. Vitamin D, what does it do? What does it help with? Bear that in mind. So what types of diseases do we no longer see because...
Cricket.
Thank you. Oh, you were listening. Wow. Yeah. Another one is tetany, by the way. Tetany, from low calcium. I've actually seen tetany when they took out a thyroid gland, and they took out their parathyroids as well, and the patient went into tetany. They go into like a spasm like that. I was my first surgical rotation, and I was doing her blood pressure, and she spasmed, and I'm like, that's not normal post-op. So, yeah. All right, vitamin D. Bear in mind, renal disease could be a problem for vitamin D. I mean, possibly. Because we don't want to upregulate the calcium too much and cause stones and things like that. Which way are you going to draw up your insulins? Know your fasting blood glucose levels. We just talked about antidiarrheals, so please go through that. Again, know your fasting blood glucose levels.
Gotta know the medications of the antidiarrheals.
Yes, please. Yeah. We talked about this a lot. If somebody has a low blood sugar, if they're conscious, what are you going to do? Give them glucose, right? If they're not conscious, what are you going to do?
Put them on their side.
Yeah, but I can't hear the first thing you said.
The glucagon emergency kit.
Yeah. I think that's pretty self-explanatory. remember the teaching, please, for TB medications. Some of the patient teaching for TB medications. Let's see, how many more have I got here? Okay. All right. A few more. Antacids. You might want to look up what antacids do, because they do a lot of different things, right? We talked about that today. Antacids. And all right. So dosage calc. You will have 5 dosage calc questions. I would suggest you know how to convert pounds to kilograms. How do you convert that? Yeah. Okay. Know how to convert micrograms to milligrams and vice versa. I do have a milligram per kilogram per day. I also have a drops per minute and a units per hour. Okay? So that is that.